If you're still having symptoms, because this is a common one we get, is it's been months to years. How can you say that this is short term? I'm still dealing with this. I still have so much issues going on. Okay, like I said, this is persistent concussion symptoms, and most of what we know about it from the scientific literature is that it is not due to ongoing brain injury. All right, that is the distinction. Persistent concussion symptoms, for the majority of literature out there, has basically found that there's no consistent literature to show that there's ongoing brain damage or dysfunction in patients with persistent concussion symptoms. So persistent concussion symptoms are due to other things. So there's two kind of main categories that you can put these two things into. Number one, it's something that happened concurrently at the time of the concussion injury. So if concussion is due to acceleration or deceleration, what else could be accelerated or decelerated at the same time, which can result in injuries that would be attributed to potentially brain injury, right? One of them would be maybe your vestibular system, right? You have little rocks and stones inside your vestibular system. If you get hit hard enough, they can maybe dislodge. That can lead to vertigo, dizziness, and balance. So you're thinking I have brain injury, but really you have a vestibular issue, okay? So it's something that happened concurrently at the time of the injury that is leading to ongoing perpetual symptoms, or it's a mismanagement of the injury in the early stages. For example, and probably the most common example, is telling a patient to rest after their injury. We know, and this has been proven, that rest causes deconditioning, blood flow abnormalities, stress, anxiety, depression, chronic fatigue. I don't even know if I said this one yet, but deconditioning. So all of these things can look exactly like concussion. So you get a concussion, your doctor tells you to rest and do nothing because your brain needs to heal, which is complete garbage and has been disproven, yet a lot of people are still telling people to do this. Rest is out. Throw it away. That's not the treatment for a concussion. But unfortunately, people have been told to rest. And what happens when you rest? All of these things that look like concussion. So then you go back and say, but I'm still having all these symptoms. Well, just keep resting. Or they try to blame you and say, well, did you look at your cell phone? Are you sure you're resting hard enough? But that's actually not the case. So again, this is not due to brain injury now. This is due to physical deconditioning, stress, anxiety, PTSD, whatever may come as a result of being told to rest and do nothing and sit in a dark room and don't talk to your friends and don't go on your cell phone and you're going to be like this forever and we don't know when you're going to recover and all of these things. That's currently what you're dealing with, not necessarily concussion, right? So concussion, persistent concussion symptoms are due to two main groups of categories, either something that happened concurrently or something that wasn't addressed early on in the recovery process, okay? And actually, for those of you that have heard of the Concussion Fix program, that is the whole purpose of the Concussion Fix program. After seeing thousands of patients come into my office, months to years after their concussion injuries, and they've only been resting. They've been told not to do anything. And I completely just go, like, you've been completely misled on this whole situation. So then you start going, no, that's not true. That's not true. That's not true. The science supports this. Let's spin this around. Let's start going down this path. And within a couple months, they're back to normal, right? Well, so the Concussion Fix program was us getting together with myself and various colleagues and saying, this is ridiculous. And so we need just to educate people. So if you want to check out the Concussion Fix program, if you're not in an area, you don't feel like you're getting good help, go to concussiondoc.io and you'll see the Concussion Fix program there. You can check it out. There's information on it. We have probably 200 people in there right now, and it's been really eye-opening for them.